Good afternoon and welcome to the annual Authority Health Best of the HealthNet Awards program. I am Alice Thompson, and it is my pleasure to serve as the Vice Chair of Authority Health Board of Directors and Chair of the Albert Schweitzer Fellowship Advisory Board. Today, we are celebrating the contributions of our volunteers and community partners to the success of our shared vision. We will also celebrate the fine work of Authority Health staff through the announcement of the Employee of the Year. Given this is a virtual celebration, we ask that you mute your devices and we thank you. And it's also my pleasure this afternoon, to offer reflections to begin our program. As we approach the dawn of 2020, I have reflected on our 2020 year. We're approaching the dawn of our 2021 year, forgive me, and I reflected on our 2020 year. This has been a very different year, a very challenging year, for some a very stressful year of losses, of tragedy, and for more, a year of fear and anxiety that's most unusual. These challenges and stresses have not just been due to the global pandemic, but also to a most unusual election year. But as I reflect on these issues, the bright light for me and the beacon of hope for me has been the presence and the work of Authority Health. Authority Health has emerged as a healing organization, embracing the principles of a healing organization, knowingly or unknowingly. It was 12 months ago that I began reading and studying about a healing organization and attempting to adopt the principles of a healing organization, a healing leader. Authority Health has been a bright light in the midst of these great challenges, and you are to be celebrated in this reflection. You operate from the principles of a healing organization. You have a culture of care and concern. You have worked to alleviate suffering and elevate joy. You have served the needs of your stakeholders, the needs of your staff, the needs of your customers, and needs of the community. You preserve and restore the ecosystem in which you operate. Authority Health leadership demonstrates the principles of a healing leader. She organizes what she does around the principles of caring and kindness. She models the values and behaviors she wishes the organization to have. She thinks creatively and she leads innovation. The reflections of our 2020 year brings to many of us sad memories, but there have been bright lights before us, and Authority Health is one of those bright lights that continues to shine and make a difference in the lives of so many. There's so much more I can say about Authority Health, but let me just say this, that during these challenging times, suffice it to say, as we approach this new year, 2021, I have great expectations that Authority Health, as a healing organization, will continue to be the bright light, the light up on the hill for our city, our region, and our state. My reflections for this meeting. It is now my distinct pleasure to present to some, introduce to others, the chair of our Authority Health Board, the Honorable Commissioner Tim Killeen. Commissioner Killeen.
So good to be with you this morning, Alice, and thank you so much, Ms. Thompson. I have a opening remarks, and in the background, people will see some photo highlights of our year at Authority Health. Authority Health's mission is to expand the safety net for the un- and underinsured. Employees, management, and the board are committed to the principles of the social determinants of health, as well as ending disparities in healthcare delivery. To our employees, a lot has been asked of you over the last several years in Authority Health, as we've had a few ups and downs. And this year, I was going to crack a joke and say, hey, 2020, nothing happened, but it did bring us a new set of challenges and people working from home and just so difficult to get the job done. I want the employees to know that it is not lost on the board of directors what you guys are doing every single day to rise to those challenges and to keep providing these essential services out there. This has also been a tough year for other essential workers in health and human services, people that work with us, that we have contracts with, businesses that are providing food and other goods that we need. So to everyone, thank you. Under the leadership of Loretta Bush, the Authority Health team has performed extremely well in adapting to the pandemic and supporting public health efforts to provide COVID testing. Most important, our primary care facilities have never stopped treating patients. We adopted virtual technology that not only maintained our connection to the community, but increased access to care. The pandemic didn't stop the Authority from moving forward and improving services at the Popov Family Health Center on the east side and the ICE Pediatric Health Center on the northwest side, and new services we are adding at the Hope Family Health Family Health Center, which is serving youth on the near west side. So a shout out to everyone that's attending this from those locations. I am pleased that we have taken a stronger role in advocacy and governmental outreach locally and in state government. This will only strengthen our capabilities in the future. Funding agencies have come to see the important role that we play in the safety net, enhancing their support of our programs, and we are grateful for that support. Authority Health has been a resilient organization, to say the least, since its inception. This year, it has proven its value to the community and potential to do even more. We are grateful for the role of volunteers and partners in the community. I also want to give a special thanks to my colleagues on the board of directors and to the governmental leaders, which means the mayor of the city of Detroit, the Wayne County executive, and the governor of Michigan, the three entities that created us in Authority Health. And they all have appointments to the board of directors. And I must say they have stepped up remarkably this year. The board is very deep. The board has can reach a lot of places. It is in no short, the fact that we are working more with other governmental organizations in no short order has to do with who we have on our board. Thanks to our Graduate Medical Education Teaching Health Center Advisory Board and the Schweitzer Fellowship Advisory Board members for your contribution. Thanks to those who volunteer with our convening groups, our provider and advisory committees, and Motion Coalition on Childhood Obesity. And thanks to the agencies and individuals that have contributed to our success throughout the year. Today, we are in the midst of a new wave of the pandemic. People in Detroit and Wayne County have been disciplined with wearing masks and practicing social distancing. That's very difficult during the holidays, but necessary. We are going to get through this. There are lights at the end of the tunnel. We have several more months of masking to go through, but we're going to be at the other end of this, and Authority Health will be there as well to do our part in supporting public health. So best wishes to all for a safe mask up, have a safe Christmas, and holiday season, keep yourself and those close to you in good health. So I think at this point, I am turning the proceedings over to our CEO, Ms. Bush, to talk about the state of the organization, if I have my list correct.
Indeed, you do. Thank you, Chairman Colleen, and thank you, Vice Chairperson Thompson. Also, I'd like to take this opportunity to give a thanks to the entire Authority Health Board. You have been committed, you have given great guidance, and you have supported myself and the entire staff all throughout the year. And for that, we are very grateful. Hello, everyone, and thank you for taking time out of your day to join us for this virtual celebration. Now, around this time last year, we were breaking bread together. Some of us were hugging, some of us were shaking hands, and we were definitely connecting in real sustainable ways. Even though we couldn't do that this year, I'm glad that you have taken this time to celebrate with us in this format, the Zoom format that we now are all hopefully getting used to. Now, for those of you who pre-registered, we hope that you have received the special gift as a token of our appreciation. The gift was provided by Sugar Please. This is a Black woman-owned company on Detroit's East Side. I'd like to thank you, Dr. Wendy Ringo. Don't know if you're on the line yet, but it was a delicious treat. So we want to thank you for that. And also we want to thank you for your contributions to community health all throughout the year. Now, I definitely believe in being transparent. So let me say right up front, unless you're a newscaster, which I'm not, most of us are used to making eye contact and connecting with our audience. We are not used to keeping our eyes laser focused on a camera. So this is what's going to happen. All throughout this presentation, my eyes are probably going to wander because that's what I'm used to. I'm going to want to look at all of your wonderful faces. So if you see my eyes wandering and you're wondering, what is she looking at? I'm looking at you because that's what I'm used to. Okay, let's get started. 2020 has been quite a year, and I know that that's an understatement. This has been a year that has been defined by a global pandemic, the likes of which we haven't seen in 100 years. Defined by a divisive national political campaign, the likes of which most of us, probably all of us, have never seen. And it's also been marked by an increase in racially driven hate and police brutality, the likes of which we all hope one day we'll never see again. But in the face of all of these things, I'm reminded and I'm encouraged by the words of Maya Angelou, who says, "And still we rise." So with that, it's my pleasure to give you a brief overview of Authority Health 2020. One of the hallmarks of Authority Health is our graduate medical education teaching health center. Our teaching health center remains one of the largest in the nation, and we provide rotations in family medicine, internal medicine, pediatrics, and psychiatry. This year, we graduated 18 physicians, but listen to this, 74% of them went on to practice in medically underserved community. We are definitely meeting our mission. One of the things that we began working on this year was to increase our ability to quantify the impact of our work. So let me share with you a few statistics. Since the inception in 2013 and the first resident graduating class in 2015, Authority Health has graduated 106 physicians. 49% of those stayed in Michigan after graduation. 62% took a job in medically underserved areas or high physician shortage areas. 52% took positions in ambulatory settings, and 13% have taken positions in federally qualified health centers. We are definitely proud of those statistics because that is the goal that we were striving for with the Teaching Health Center. Our residents not only have specialized training in community settings, but they also receive training and a certificate in population health. They also receive special education in trauma-informed care. And beginning in 2021, they will also receive training in justice and racial justice and implicit bias. So let me just stop to say the killings of George Floyd, Breonna Taylor, and countless others whose names we may not know rocked us at Authority Health at our very core. We spoke in support of community policing and appropriate law enforcement, but we also spoke out against chokeholds and no-knock warrants. We entered this space because we know that these are public health issues, And we agree with our governor when she proclaimed that racism is a public health crisis. Not only is it our intent to train excellent primary care physicians, but also we are training physicians who can speak truth to power and are well prepared to address the concerns and the many issues faced by our safety net populations. This year, we expanded our curriculum in trauma-informed care. Our initial program increased awareness and understanding of the importance of underlying trauma that children have experienced. And it's always great to start with awareness and understanding. However, we found in our first year of piloting the curriculum that there was a need to help residents understand the numerous resources that are out there, many of which our partners that are on this particular Zoom call provide. It was also necessary for them to have time putting their training into practice. Additionally, we realized the risk to the health of our resident physicians through long-term repetitive exposure to the impact of trauma on our patients. This second year seeks to address both of those things. Our residents were also instrumental in our COVID response. Literally within hours of determining that we would need to pivot our operations into crisis mode due to the pandemic, our community partner, Detroit Central City, asked us to join them in testing and infection control at the Salvation Army Harbor Light. Under the direction of Dr. Ernie Yoder, our medical director for clinical operations, we mobilized our residents to address the immediate needs of the pandemic, while also keeping our primary care services going to the community and supporting efforts to provide COVID testing. Again, in partnership with Detroit Central City, our residents, our clinical staff, also were the first to provide community COVID testing utilizing church parking lots. Early in the pandemic and within the first few weeks, we had already provided community COVID testing to over 4,000 people, almost doing 1,000 in just one day. I'm going to turn my attention to the Popoff Family Health Center. We acquired that health center a year ago this past July. Who would have ever guessed that we would be building a new practice during a pandemic? But still we rise. We have continued to build a strong clinical team on Detroit's East Side. That team is led by Ms. Kelly Heron, our practice manager, by Dr. Hussein Shagir, who is also the director of our family medicine residency. And also we are joined by our newest staff member, Mr. Vincent Jones. Now you're somewhere on the screen, Vincent, so just kind of raise your hand. So, oh, I see you, so that people can know who you are. He looks forward to connecting with you and getting to know this community. During this period, we initiated several new services. Of course, I'm going to mention telehealth. Just like many of you, during the initial days of the COVID pandemic in Michigan, we instituted a robust telemedicine program that provided clinical care during the lockdown. This includes hundreds, literally hundreds of assessments that were provided to people seeking testing at the state fairground when a doctor's order was initially required. Now that we have reopened our offices for in-office visits, we also continue to provide telehealth. This expands our access, the access of our patients to primary care, and these expansions also helps with things like transportation and other physical barriers, but it also keeps our patients and our staff safe as we continue to navigate this pandemic. Now, I'm excited to mention that we also started providing medication-assisted therapy. This is proven to be effective in helping people become free from opioid and alcohol use. Our clinical services includes the use of Sublocade or Vivitrol, and both are provided by injection. In addition to that, we have hired Dr. Sheena Sharma to provide the behavioral health component to that service, and that is vital to the success of recovery. And let me just stop to say, in a previous position, I have seen medication-assisted therapy change lives. So we really invite you, if you have patients, clients, family, friends that are in need of recovery services, please consider us as your referral partner. Dr. Sharma's arrival also enables us to fulfill our goal of integrating primary care and behavioral health services across our entire patient base when appropriate. We also started instituting sports medicine. Now, don't let that title fool you. You don't have to be an athlete to be a candidate for sports medicine. We offer this service to many of our patients, those who have been diagnosed with osteoarthritis, joint pain, carpal tunnel, knee pain, shoulder pain, musculoskeletal disorders, back pain, and back injury. All of these are appropriate for the use of ultrasound-guided injections. This is a treatment that usually requires a referral to a pain clinic. We are very fortunate that both Dr. Shagir and Dr. Gill are both trained in sports medicine. Now, I know probably the staff at this point are saying, please, Loretta, are you going to tell your finger trigger story again? Why, yes, I am going to tell it again. So during the initial pandemic and the lockdown, I developed a very painful and disturbing condition that I later found out was called trigger finger. When we were finally released and able to go back outside, I was scheduled to go to a hand surgeon. Fortunately, we had already invested in the ultrasound machine, and we had the talents of both Dr. Shagir and Dr. Gill. Instead of going to the surgeon, I went to Dr. Shagir, who then provided ultrasound-guided injection into my hand. Absolutely relief, wonderful, helped me to relieve pain and also to avoid surgery. So if you're like me, I really don't want to be leading anything that I wouldn't use myself. So I have to say thank you, Dr. Shagir, for your amazing talent. This also demonstrates the breadth and the depth of services that can be provided in the primary care setting. This gives us the one-stop shop that we know is so vital to providing care to our communities. Next, we have expanded and grown our osteopathic manipulation therapy. I'm going to call that OMT because that's a mouthful, right? I almost got it out right, even after practicing it almost all morning. So OMT is a set of hands-on techniques, and these are used by osteopathic physicians to diagnose, to treat, and to prevent illness or injury. Using OMT, a DO moves muscles and joints and uses techniques that include stretching, gentle pressure, and resistance. When appropriate, OMT can complement or even replace the need for opioids or for surgery. So you can tell that we are very proud at Authority Health in our ability to offer pain management services that does not involve the use of opioids whenever appropriate. Also, we opened a pharmacy this year at Authority Health. It's located in Popoff, and we are pleased to welcome our pharmacist, Maria Young. She is a community pharmacist. The pharmacy is available to the patients in all of our 3 clinic locations. And in addition to dispensing, Maria also provides medication review and management, as well as patient education and support. Maria also leads our efforts for flu vaccination, and that's even more important in this COVID environment. She has 4 community flu vaccines events planned, 3 of which are drive-up events. As a community pharmacist, Maria has lots of great ideas, and I am confident that next year when we come together again, I'll have a whole host of things to share with you. I am very pleased to announce that we also opened the Mare'Ice Pediatric Health Center on October the 1st. Now, we had planned a ribbon cutting and an unveiling of the signage, and also a virtual tour was planned as part of this celebration, but COVID, right? And also the 3-week pause that our governor called for. So all of this had to be postponed. It still will happen, the ribbon cutting and the tour of the pediatric practice. Now, the Mare'Ice Pediatric practice has become the primary continuity clinic for our pediatric residents. And this continues the tradition that was started in Dr. Ice's private practice. The health center is named after Dr. Ice. And as you know, she is one of Detroit's finest pediatricians. She has cared for generations of children and adolescents, as well as being a mentor for many young physicians. You'll hear more about Dr. Ice later in our program. Located in the northwest side of Detroit, in the Detroit area, the Ice Pediatric Health Center offers high quality, affordable care for children in our community. From newborns to 21 years old, we work hand in hand with parents to make sure that children and adolescents in our community are receiving the services that they need. We are providing everything from same-day sick visits to well child visits, immunizations to management of hypertension, dental varnish to ear piercing, and everything in between. I look forward to our first year with the pediatric practice and seeing how this practice can partner with many of you. Another new development this year is the establishment of the Hope Family Health Center. Located at Hope Academy in Northwest Detroit, the Hope Family Health Center was made possible through a grant from the state of Michigan. Under the administrative direction of Dr. Carolyn Custer, the Health Center is dedicated to the health and well-being of the students at Hope Academy, but also we are very pleased to have a door to the outside, and we will be also available to the surrounding communities. While students are not having in-class instruction right now, we are using this time to build out the clinical space. We are also operating in temporary space, providing limited services, including vaccinations. Dr. Custer, I know you're on the line somewhere. I can't see you, but I applaud you because Dr. Custer successfully wrote the grant for the school-based clinic in the height of the COVID pandemic. At Authority Health, we also value where we started: convening, community engagement, and partnership development. The Motion Coalition continues to be a vibrant component of our convening and community engagement work. Under the leadership of our co-chairs, Dr. William Dietz from Georgetown University and Diane Balad from Henry Ford Health System, the Motion Coalition has become a strong advocate for active living and healthy eating in its efforts to minimize childhood obesity. The coalition is also laser focused on informing policy, as it recently did on 10 cents a meal, which brings additional funding to Detroit schools for fresh fruits and vegetables. We definitely appreciate the support of several community partners in this work. Now, we also formed an affiliation with the Detroit Disability Network. One of the populations that has been affected by health disparities are those with physical and mental challenges. Our work with the Disability Network has the goal of reaching this population and providing the care they need in the way that they need it. That includes both in-office and home care support. One of our Albert Schweitzer Fellows, Sean Jones, is assisting in this effort. Now, we also entered into a partnership with another community provider to provide annual exams and other medical services to women that have been newly released from the Michigan Department of Correction and the Federal Bureau of Prisons. Our professional work development is also integral to the mission of Authority Health. In addition to our medical residency program, we are fostering a learning community in other ways. Our Albert Schweitzer Fellowship this year is supporting 6 fellows in humanitarian leadership development and community service. We also offer internships in health data analytics and other community interests. I want to thank many of you that are on this Zoom call because our Schweitzer Fellows have been a part of some of your communities, and we are thankful for that. Now, this is a list, just a small list of our current and budding partnerships. I could continue, but I want us to have ample time for the rest of our celebration. I'm going to turn my attention now briefly to philanthropy. Most of our work requires the support of government and philanthropic grants. Our major grants comes from the Health Resources and Services Administration. Most of us are used to saying HRSA, and they support the GME Teaching Health Center program. Even as we speak, Congress is negotiating the resolution of the federal budget, which includes a request for reauthorization of the National Teaching Health Center program. We are hopeful that the elected officials who have voiced support for this program will find the resources to extend the funding and support expansion. Please note that your voice is also very important in making your wishes known and support of the teaching health centers. We are also grateful to the state of Michigan for providing funding for the Hope Family Health Center, the Children's Foundation of Michigan for support of our community medicine and trauma-informed care programs, and the Metro Health Foundation, Black Family Development, and PACE of Southeast Michigan for their support of the Albert Schweitzer Fellowship Detroit chapter. We also appreciate the individual donors who have enhanced our ability to pursue our mission. Now, Authority Health's strategic plan called for strengthening our community health center capacity, advocating for reauthorization of funding for graduate medical education, and enhancing various aspects of community engagement. I'm pleased to be able to say that the pandemic did not change that strategy, but it did force us to focus on crisis response, challenging our creativity and our resolve to continue to be a preeminent safety net organization in our region. Crisis indeed tests leadership and the resilience of people under sudden and extreme pressure. It also brings an opportunity to those who are innovative and high-spirited. This is what has defined Authority Health as the pandemic set in. We are a resilient organization that adapted to the pressures, the challenges, and the uncertainty while maintaining clinical operations, rapidly instituting telemedicine, successfully writing grants, and adapting to remote work environments, even as we, as part of the state, worked to flatten the curve. Allow me to take a moment to salute and to thank the dedicated, hardworking staff at Authority Health. Now, in a year in which everything seemed to have stopped, we have done even more than we set out to do. On a broad scale, the political and the virus crisis has drawn attention to the absolute importance of public health and creating a strong public health infrastructure. It's only through enlightened public leaders informed by science, I'll say that again, informed by science and by moral values, that we create healthy communities. To that end, we are proud of our governor and our mayor, as well as their public health staff, and their ability to manage this crisis as best they could to keep us all safe. I also believe that Authority Health, together with you, our community partners, has made a significant contribution to this effort. I want to thank you again for joining us, and I hope you will stay and enjoy the rest of the program. All right. Now, it is my pleasure to introduce to you Dennis Archambault, our Vice President of Public Affairs, and he will begin our Best of the HealthNet Award program. Dennis?
Thank you, Loretta. It's a pleasure to be with you again for this auspicious event. Authority Health established the Best of the HealthNet Awards to recognize the outstanding contributions of our volunteers, our partners, and our stakeholders in the mission we all share. Nominations for the Best of the HealthNet Awards come from members of the community, as well as from our staff. In this special virtual format, our presenters will read their nominations, and then the recipient will have an opportunity to say a few words. We ask the recipients, once you're ready to comment, to remove your mute so that we can hear you clearly. Our first award presentation this afternoon will be presented by Michelle Calloway, Social and Community Service Manager at Authority Health. Michelle?
Good morning, or good afternoon, I'm sorry. It gives me great pleasure to have an opportunity to introduce Veronica Claybrone. I first met Veronica Claybrone when I first started with Authority Health. At the time, we were Detroit Wayne County Health Authority. Veronica was serving over 100 meals a day in a basement of a church on Warren and the Boulevard with no funding. I was really impressed. I asked Veronica, what could we do as an organization to help her fill some of the needs and gaps in the community? Veronica said that she was really concerned about the young mothers and pregnant women in the community, and that they did not have some of the basic needs. Along with the late Sophie Womack, Channel 7, and the Medicaid HMOs, we together put a community baby shower together. It was truly a success. However, Veronica came back to me and said, Michelle, that was very nice, but there is still a need. These mothers don't have diapers. She told me a story about a mother who would take a diaper and last a week. And I said, how is that possible? She said, well, she would take paper towel. You remember that, Veronica? And she would put the paper towel inside the diaper and along with plastic. When the diaper was soiled, She would remove the paper towel and put other paper towel, new paper towel in there. We found that there was a diaper bank in Wayne County, but they did not want to come to the Detroit area. Cheryl, my coworker, found that the diaper bank was in Canton, Michigan. So Cheryl would once a month load up her SUV and bring diapers to the church for Veronica to give out diapers. The diaper bank, that went on for about a year, and then the diaper bank in Canton discontinued. Veronica picked up the challenge, and I am so proud of her. She now is not only servicing Wayne County, she's servicing Oakland County and Macomb County. The diaper bank provides diapers for infants, toddlers, and adults. She has also started a potty training program to help young mothers potty train children to get them off of diapers. Veronica, I am very proud of you. I am very proud to have an opportunity to present you with this award. And if you will now congratulate yourself and say a few words.
Thank you so much, Michelle. I appreciate and I feel very honored. I can't take this honor by myself because they're the people that I call my boots on the ground, and some of them are on the line today. I actually saw Susan, who's from the National Diaper Bank. Along with the National Diaper Bank, we get donations, and we get a terrific buying power from the Huggies diaper manufacturers. I am so honored and excited to tell you that we went virtual with our toilet training. Our goal is to alleviate diaper need in the metropolitan Detroit area. So when we went virtual, it was a flux of parents that came aboard, and they're training their babies and preparing them to go to early Head Start. I'd like to say today that we're being pressured for diapers all over the city. There are 250 requests coming in through our online requests every week. We've done 90,000 diapers per month since March. My boots on the ground never stopped. We were doing diapers in March. When the COVID came, we just flipped the script and kept doing them. So we've gotten up to 90,000. That was our goal. We've surpassed it. But with the stimulus not coming through, our demands have increased tremendously. We have 500 to 600 people every week requesting a pickup of diapers. I ask you today to please thank my boots on the ground that's on the line. I am so proud and happy to be a part of that structure. I also ask this day that you would please go to DetroitDiaperBank.com. That is our webpage for further information about what we do, how we get the job done, and the people that we serve. And I'd also ask you to push that donation button while you're there and make any size donation that you can. Thank you again for the honor. I appreciate it. Michelle, I appreciate the nomination. Ms. Bush, I'm thankful that you all selected me to receive this award because we are connected to health issues, rashes, babies get urinary tract infections. If you've ever had one, you can only imagine how a baby would feel, which causes them to cry, which can cause abuse and neglect, because the parents are already under a tremendous amount of pressure, just dealing with the homeschooling and the tremendous need that's been there way before the pandemic. So I thank you again. Don't forget, push the button.
Congratulations, Veronica, and thank you, Michelle, for making the nomination. Our next presentation will be given by Lee Watson, Public Relations Manager at Authority Health.
Thank you, Dennis. Impactful. That is the word that can be used to describe Michael Randall's involvement in the metropolitan Detroit community. Michael found value in the work and has had a great way of connecting with people. In fact, Michael Randall is a tireless advocate for individuals. He has devoted his career to community development, and his expertise includes public health, urban housing, and community enrichment. He has served on both public and nonprofit boards. He has also trained others to provide access to public benefits. Michael knows and understands the community from a grassroots level, having served as a community resource navigator for Washtenaw Health Plan. And in that capacity, he worked with agencies across Washtenaw County supporting the implementation of the Healthy Michigan Plan and providing access to healthcare and food assistance for families and individuals in need. Mike was also a social entrepreneur. He is a co-founder, along with his wife, Elena, of Maureen James Community Enrichment, an agency dedicated to community development. Now, director of community impact for the American Heart Association, he drives market health assessments, organizes and leads community collaborations, and builds and implements plans for policy. He works to ensure population health strategies that are integrated into development, advocacy, and healthcare quality improvement activities. Michael has collaborated with Authority Health in our Go Red, Healthy Heart, Fresh Prescription, and Motion Coalition initiatives. Dr. Ernie Yoder, our Director of Medical Education here at Authority Health, has worked with Michael and the American Heart Association with initiatives relating to the Papa Family Health Center. Dr. Yoder has said, Michael has supported implementation of patient education through provisions of patient-centered materials and access to online resources to facilitate conversations regarding the relationship between diabetes and heart disease. We want to congratulate Michael Randall on this honor.
Wow, we did all that. So thank you so much, Lee, for that introduction. I can speak for myself. I'm pretty sure I can speak for everyone on the call that, you know, when we got into this work, we didn't get into it for awards or anything like that, you know, or positions or anything. We got into it because we wanted to change lives and impact our community. And I'm just so honored to work shoulder to shoulder with organizations like Authority Health. Loretta spoke at length about the perilous times that we're in right now. And you know, what a time to be alive, such a time as this. All of those things that I've heard growing up, it just makes so much more sense now. And I'm just honored to stand shoulder to shoulder with organizations like Authority Health that understand the problems that we're dealing with in our community and have the capacity and the bandwidth to get things done. So Loretta, Dennis, Lee, Dr. Custer, Dr. Yoder, you all have adopted me into the Authority Health family. And so I thank you so much for that. And I would be remiss to not thank the American Heart Association. I'm absolutely, nothing is possible without the leadership of our Senior Director, Kristen Hurley, my counterpart, Mixie Cardona, our Executive Director, Laura Vaughn, Catherine Knoll. These are individuals that allow me to go out in the community and do what I do. And so none of this is possible without the backing of a strong organization like the American Heart Association and our team here in Southeast Michigan. So thank you all so much. I'm honored, and we have a lot more work to do, so let's get the work done.
Congratulations, Michael. It's been a real pleasure working with you, and thanks, Lee, for the nomination. Our next award presentation was to be given by Dr. Kaya Pittman-Hunt, our Director of Pediatrics Residency Program and Associate Director of Medical Education. She's very, very fond of our awardee. Apparently, she was not able to make it this morning, but Dr. Ernie Yoder, our Director of Medical Education and Clinical Operations, will present her nomination. Dr. Yoder, you may be muted.
Apologies. Thank you, Dennis. The strength of the Authority Health Graduate Medical Education Teaching Health Center program is due in large part to the expertise of our preceptors. Dr. Mare'Ice has been a long time, much loved preceptor for our pediatric residency. Her practice has offered our residents an excellent experience in terms of diverse medical problems, as well as her mentoring from years of practice experience. Dr. Ice's contribution to the health of children and adolescents in Detroit goes back nearly 40 years. In that time, thousands of young people got healthy starts in life through her skills and commitment. Dr. Ice has been a leading African-American physician in Detroit as well. She has been a clinical professor of pediatrics at the Wayne State University School of Medicine and an adjunct professor at the Michigan State University College of Human Medicine. Dr. Ice has been a member of the medical staff at Children's Hospital of Michigan and DMC Sinai Grace Hospital and has served as chief of pediatrics at the DMC Sinai Grace Hospital. As we develop the Mare'Ice Pediatric Health Center, our residents will not only have a good continuity experience, but they will train under pediatricians who themselves trained under Dr. Ice. Her legacy will live on. And let me say personally that I came to Detroit in 1974 for medical school. And while a medical student, it became obvious to all of us that Dr. Ice's role in care of children and in training future pediatricians was something for Detroit to be proud of. So congratulations, Dr. Ice.
Dr. Ice, would you like to say a few words?
Yeah, excuse me. Yes, I would. Thank you very much for this award. I'm very, excuse me, very proud of it. And I'd like to thank Kaya for nominating me and your lovely introduction. And I would also like to thank Mr. Killian and Mrs. Thompson and Mrs. Bush for allowing me to continue to do what I really enjoy doing, which is teaching the residents. And I've, over the years, I've taught residents, medical students, nurse practitioner students, PA students, all types of students. And I started really when I first went into practice. So I've just enjoyed it over the years. And I think it's I really enjoyed being with Authority Health because your mission is the same as my mission. I have felt over the years that I could have, gone into the suburbs and just treated patients who had insurance or whatever. But I'm a native Detroiter. I grew up here. I went to high school here and everything. And I just really feel that Detroiters, and especially Detroiters who may not have the best resources or have everything that they need to have good medical care. And so I have always wanted to make sure that I was taking care of patients in the city of Detroit. And it's been a very rewarding and satisfying position for me to do that. I've also enjoyed teaching residents and students because we, as physicians, we need to make sure that we provide the type of information that we have to the people that are coming behind us so that they can achieve whatever we've not achieved in the time that we've been working. The one thing that I really have been happy about is that all of the Authority Health residents have been excellent residents, very well chosen, very compassionate, very interested in the community. And I feel that this has been a wonderful collaboration.
It's been a pleasure to work with you, and I look forward to continue supporting your practice in the area in the Pediatric Health Center. Our final Best of the HealthNet Award presentation will be given by Loretta Bush, President and CEO of Authority Health.
All right, thank you, Dennis. So I am going to have to stick to my script because Dr. Kimberly Farrow means everything to me, and I could just go on for the next half hour. It gives me great pleasure to be able to present this award to Dr. Farrow. You know, in the time of crisis, people need to collaborate. And I have to say that if you look in the dictionary under the word collaborator, you should see a picture of Dr. Kim Farrow. I remember from the day I picked up the phone in the height of the pandemic, and I heard these words, "Hey, Loretta Bush," I knew that my life would never be the same, and it would be in extremely positive ways. Our partnership took an interesting direction early in the early days of the pandemic when PPE was scarce. Dr. Farrow received donations to make a major purchase from a Korean company. Now, when I say she received donations from both sides of the aisle, from all kinds of people. And I was like, Kim Farrow, how did you get money from this person or this organization? But she did it. At the time, the federal government was not able to provide the necessary PPE for critical states like Michigan. And that forced us as providers to be on our own, to get our own from whatever source at whatever price they were offering it. Dr. Farrow and I also spent several hours, countless hours on the phone with Korean labs, 9 p.m. our time, which was 9 a.m. their time. We talked about reagents, predictive values. We negotiated for swabs, which suddenly became unavailable in the United States. We couldn't get these things anywhere else. Dr. Farrow also was successful in locating a new lab partner when our usual labs were too busy and became overwhelmed servicing the needs of their larger clients. Now, while we waited for the PPE to arrive from overseas, Dr. Farrow did something that I will never forget. Our own Authority Health clinics had almost run out of all PPE. Dr. Farrow then gave Authority Health PPE out of her own agency's limited stock to tide us over until the shipment arrived. And actually, if I remember it right, I think we met in an alley in the dark and we exchanged things that way. She gave us gloves, she gave us masks, she gave us alcohol. It was just an amazing thing that she did, and a selfless collaborator. After securing this very large purchase, she also had to deal with customs, with delivery delays, with supplies that were confiscated by the US government. And then finally, the weeks went on, and it finally arrived with Dr. Farrow and I talking endlessly. Loretta Bush, it's in California. Loretta Bush, the supplies are on their way. And finally, they came. Then she did another very interesting thing. Now, with a large supply of PPE in hand, she made it available free of charge to all of the FQHCs in Wayne County. Among her other contributions, Dr. Farrow is also the co-chair of our Provider Advisory Council. Dr. Farrow is indeed a servant leader. She's an excellent partner, an amazing physician, an incredible collaborator, and at her very heart, she believes in serving this community. Dr. Farrow, you are truly the best of the HealthNet safety net. Thank you so much, Dr. Farrow.
Wow. I am so moved and I'm so honored to be recognized by you all. And let me pull it together. Every word is true. You know, Loretta, I have to tell you that Authority Health, you and your organization exemplify partnership. I knew that if I made that call, that one call, I had to make that one call, it would be to Authority Health. And we were in agreement that we were going to ensure that Detroit area citizens had access to high quality healthcare services and also testing opportunities. And we did just that. And so as much as I'm honored to receive this award, please know that I did not do it alone, that Authority Health was right there alongside Central City, making this happen for the Detroit area citizens. So thank you so much. I am so deeply moved and honored by this recognition, and know that you will always have a partner and a friend at Central City Integrated Health and in me. Thank you so much.
Congratulations, Dr. Farrow, and thank you, Loretta, for a great nomination, and a hand for all of our awardees this year.
Thank you.
Okay, now we move on to the major event in the lives of our employee community, and that's the 2020 Employee of the Year announcement. And I would like to turn it over to Patricia Johnson, our Director of Human Resources.
Thank you, Dennis. Often in our careers, we are presented with opportunities that we may not see as something we will want to do. One of our employees had advanced degrees in her field and had certain goals she wanted to achieve at Authority Health. However, received an opportunity for a career growth that she wasn't looking for. Our Employee of the Year is very hardworking, often a force of energy around her peers. She is always looking for ways to educate herself and improve her work process. When offered suggestions from her supervisor, our president, Loretta Bush, she follows instructions to a T. Our Employee of the Year exemplifies the professional flexibility, creativity, and work ethic that helps advance the mission of Authority Health. Her positive spirit, good humor, and willingness to take on difficult challenges makes her an outstanding employee. On behalf of our president, Loretta Bush, and all of the employees of Authority Health, I am so delighted to present the 2020 Employee of the Year Award to Kelly Heron, our practice manager of the Pop-Up Family Health Center. Kelly assumed her position at a critical time. Not only did we need her to bring stability to the operations of the health center, but we also needed to build a team spirit during the turbulent early days of the pandemic. She came in and developed immediate rapport with staff, instituted processes, and collaborated with medical and administrative leadership. It was like flying an airplane while building it. Right after taking the position, she became very ill with COVID-19. Mrs. Bush says that Kelly is the most flexible employee she has seen in her entire career. 3 different job assignments in 12 months, and has risen to the occasion each time. She pivots quickly when confronted with work challenges. When we began mass testing, she took the lead in setting up procedures for registration. It was a major task-making arrangement in our parking lot and observing COVID safety precautions in the clinic. Kelly is an asset to the Authority Health team, and we are all very proud to be her co-workers. Congratulations, Kelly.
I want to thank Authority Health for recognizing all of my efforts. I want to also say that I'm not a person of a lot of words, but I do not want that to be a reflection of how grateful I am for the recognition. I also want to thank all of the support that I have received, the opportunity that I've had to grow. So I just want to thank you for the recognition, and I appreciate all of Authority Health has given to me personally.
Wow. It is my pleasure to bring closing remarks. This has been a magnificent program. And congratulations to our Employee of the Year, Kelly, and the Best of the HealthNet Award winners. Great honorees and great recipients of this award. Our mission is a community mission that will only be accomplished through collaboration. So thank you for being partners with us. And again, I remind you, in spite of the challenges we've had this year in 2020, Authority Health has been a beacon of hope, innovation, creativity, in a bright light. But before we close out today, let me bring back again to you, Commissioner Tim Killeen, to make a special presentation. I'll come back and give a true closing. So Commissioner Killeen, please.
Thank you, Ms. Thompson. I think I appropriately hit the unmute. Yes. Yes, the following special award was recommended by the employees of Authority Health. True leaders rise to the occasion in times of crisis. Last spring, Loretta Bush called a meeting of her administrative and clinical leadership to discuss the need to respond to the rapidly developing coronavirus pandemic in Michigan. This was before the governor issued her shelter-in-place executive order. With personal protection equipment in low supply and Authority's health implementation of telemedicine still in the planning stages, she instructed clinical staff to address safety issues at our health centers and administrative staff to begin working remotely from home. By midweek, the shelter-in-place order from the governor had been issued. Her immediate concern was twofold: maintain the safety of staff and serve our community. The first challenge was to assure safety. With the absence of support from federal, state, and local health organizations, had to purchase mask, gowns, and gloves on their own. Ms. Bush spent the weekend in partnership with Detroit Central City, as we have heard, to negotiate the purchase with an Asian firm. She was literally on the phone all night working desperately to secure the purchase. She succeeded, only to have the shipment stalled at customs. Her resourcefulness and ability to collaborate secured small quantities of PPE from various sources. The second challenge was to meet the needs of the community. Ms. Bush directed staff to limit personal access to our health centers to urgent medical concern and moved rapidly to acquiring telehealth technology. Authority Health joined the city of Detroit in efforts to initiate assessments of people who qualified for COVID-19 tests. We began assessing people for COVID testing by telehealth equipment. Eventually, Mrs. Bush and staff negotiated supplies in partnership with a laboratory to conduct our own testing. Loretta Bush, a seasoned public health official, and yes, I did say seasoned, took Authority Health to the community and set up arrangements with area churches to conduct COVID testing. More than 4,000 tests were performed by our residents and our community workers. It is important to note that Mrs. Bush was intent on not closing our primary care services during this time. Unfortunately, several members of our medical and clinical staff developed COVID infections during this initial period. But since the initial period, our staff has remained healthy. Administratively, she was patient, but fair in her expectations that businesses will continue effectively in the remote setting. While several employees were working out of makeshift offices at their home, we managed to be productive. And while this was working well, Ms. Bush was aware that one important aspect of our mission, Medicaid enrollment, was diminished through the remote location. That function needed an office and a safe protocol for client encounters. In June, Governor Whitmer began loosening the state executive orders, allowing administrative staff to return to their offices. Mrs. Bush led the development of an extensive 35-page playbook that detailed virtually every step of the reentry, from the temperature reading at the reception desk to break room protocol and the all-important edict: wash your hands. Masks need to be worn outside of offices, no meetings in offices and small conference rooms, safety first, but productivity just the same. She adopted a hybrid staff model in which only 50% of the staff was present at the office at any given time. Most meetings have been conducted by remote technology. Staff has been safe, and the community has been served. As the infection rates began to increase this fall, Ms. Bush became concerned, like she was last spring. She concluded that she should probably need to return staff to remote status, but the governor beat her with a limited public health order for businesses to operate remotely when possible. We have smoothly reverted to remote work while maintaining normal clinical operations. So here we are, riding another wave. We are confident that our mission will continue and staff will remain safe. In recognition of the outstanding leadership during the coronavirus pandemic, staff members of Authority Health wish to present Mrs. Bush with an award of appreciation. It is an image of a figure moving a boulder. Below, the inscription says, "The best way to predict the future is to create it." Congratulations to Loretta Bush for her 2020 leadership. Mrs. Bush, you have the floor for any comments you would like to make. Thank you so much.
Wow. Okay, so you know the first comment I'm gonna make is you got me, right? You managed to do this and me not find out about it, which is amazing because I try to know everything and touch everything and be available. So you all, yeah, you got me. I so appreciate this acknowledgement from the staff. This year has been a challenge, but still we rise. And it is because of you that we were able to do it. This is one of the best assignments in my entire work life. I so enjoy being here. I so enjoy working with all of the staff at Authority Health. I so enjoy working with all of our community partners, continuing to learn, continuing to touch lives in really important ways. I'm still very surprised and overwhelmed about the fact that you were able to get this one past me. So just let me say thank you, thank you, thank you. We'll continue to serve the community and we'll continue to stay safe. We know that this is just a moment in time and that we will continue to do our good work. And one day we'll be able to get together again, face to face, and celebrate the many accomplishments, not only in Authority Health, but also all throughout with all of our community partners. Thank you so much, Authority Health staff.
And thank you, Loretta. Loretta Bush, President and CEO of Authority Health, a phenomenal leader, a healing leader, and a leader who is anointed for the work that you have been called to do. And so as I truly close out this time, I'll thank you all for sharing your time, your talents, and your treasures with Authority Health. Whether you are a volunteer or a donor or both, you help this organization make a critical difference in the healthcare ecosystem safety net. So I wish you all a healthy, peaceful, joyful, and safe holiday season.